Katina, and good afternoon, everyone. Since we were here last week, we've had another death in Nova Scotia that was in the community in Central Zone. I want to say to that family, our thoughts and prayers are with you and your loved one. As I've said many, many times, the difficulty of losing a loved one at any time is hard, but doing it when COVID is happening and all the restrictions around being able to gather makes that loss even more, because it's part of the grieving is coming together, and with the restrictions around COVID is very difficult. So I want you to know that that is not lost on all Nova Scotians, and again, you are in our thoughts and prayers. I also want to remind all Nova Scotians that there is a province-wide fire ban in place. Many of you would have seen this weekend we had a number of fires across the province. A number are still ongoing, and I want to thank the emergency responders who have helped, whether it's been through evacuation or the firefighters who are out there fighting those fires, our crews from DNR who are working there. And in many parts of our province, fire services volunteer. They are men and women who have other jobs in our communities who are helping build our communities. But when the fire whistle goes, they respond to the needs of our communities. And fighting any kind of fire is difficult. Fighting one of these a forest fire is draining physically on those individuals. So I want to say to them how much we appreciate what you're doing on behalf of all of us, and we want to thank you. Dr. Strang.
Thank you, Premier. Good afternoon, everybody. And I, too, want to share my condolences and sympathies for the family who dealing with this, our latest death from COVID-19. The individual who died is a female in her 80s who had underlying health conditions and lived in Central Zone. She was not a resident of a long-term care facility. This, unfortunately, brings the total number of deaths in Nova Scotia to 59. I'm also reporting 2 new cases of COVID-19 in Nova Scotia. Important to understand that both of these cases were known contacts of a previous case, so we know how they got exposed. There's no indication that they were exposed in sort of general community exposure, which is good news. I know that many of you watch the numbers very closely and have sharp pencils. So you'll notice that yesterday we reported a total of 1,051 positive cases in the province. And today, even though we're reporting 2 new cases, the total number of positive cases reported is 1,052. As I've mentioned previously, the testing that's been done by the lab is very accurate, but no test is perfect. That means there's always a small chance that for a test to have an inaccurate or an indeterminate result. And we know that in examination of one of our more recent cases, and as we're testing residents and staff at Northwood, we did have a case that had been reported negative for a period of time, then had a positive test and was followed up by a negative test. As we examined that closely with the lab, it was determined that this was a false positive test. So that's why you see that the number has gone up by 1 for a total number of positive cases to 1,052, even though we're reporting 2 new cases today. Just wanted to make that clear for your mathematicians out there. The QE2 lab processed 573 tests yesterday. We currently have 7 individuals in hospital, 4 of those are in the ICU. We have 976 people who can be considered recovered from their COVID-19 infection, and we've had 38,999 people who have been tested but with a negative result. And it's nice to be able to report that we only have 1 licensed long-term care home in Nova Scotia now with active cases of COVID-19. That is Northwood in their Halifax campus, and they currently have 11 residents and 4 staff active cases. I want to end by reminding people that we broadened the list of symptoms that we want people to be tested, and we've had a significant number of increased number of people over the weekend and today calling 811 and being tested, which is exactly what we want to see. So again, that's it. Excuse me. That symptom list is longer now, so it's fever, new cough, sore throat, runny nose, headache, shortness of breath, sneezing, muscle aches, if you have hoarse voice, diarrhea, loss of smell or taste, unusual tiredness or fatigue, or red, purple, or blue lesions on the feet, toes, or fingers that don't have another explanation. And a lot of those symptoms are common. Some people have them chronically. It's more if there are symptoms for you are new, or if they've gotten a whole lot worse if they're chronic symptoms. And the vast majority of people that we know, we have cast a very broad net that you need to get tested. The chances of you having COVID are low, but we still want to make sure we're testing you just to, our objective is to have a very low threshold and be very actively seeking out anybody who may have COVID-19 and getting them tested. So if you have any of those symptoms, do the 811 online assessment, or if you can't do that, call 811 and you'll get direction from there. Premier.
Thank you, Dr. Strang, and Tina will be happy to answer any questions the media have.
Again, just a reminder, we'll take one question, one follow-up from reporters on the line in the allotted time that we have. We'll start with Mike Gorman from CBC. Go ahead, Mike.
Thank you. Premier, earlier this month, in response to some concerns that essential service workers, particularly in the healthcare industry, have voiced, you said that you were going to be asking the Education Department to revisit what can be done in terms of childcare for essential service workers. And so I'm wondering what the status is of checking in on that, and I'm also wondering if you believe June 8th is still a reasonable expectation for daycares to reopen.
So thanks for the question. So as you know, we didn't close all of their daycares. 5 are under. We're still able to provide childcare. We had not had a large number of requests around actually for providing childcare for essential service workers. That seemed to have, there seemed to have been organically dealt with through whether support in communities or different, the smaller home or daycare centers that were looking after the children of our frontline healthcare workers. And as far as the 8th, Dr. Strang has continued to work with that sector, and we're optimistic that the 8th will be achievable.
Go ahead with your follow-up, Mike.
Thank you. On a different topic, Premier, today during a Halifax Regional Municipality Council, Councillor Bill Karsten raised concerns about what he called is basically an emergency and crisis financial situation for municipalities. And he said that everything that they're doing within their budgets amounts to Band-Aid work, that what they really need is financial help from the province and the feds. But he says that at the moment, the provinces haven't stepped up to talk with the feds about this. So can you tell us specifically what conversations this province has had with the federal government about potential financial help for municipalities?
First of all, I want to congratulate and thank Councillor Karsten, who I understand announced this weekend he was not reoffering. I want to thank him for his tremendous service to his community and to the broader HRM. We've continued to work through staff level here in the province with the staff at HRM about what are the projects they require support on, what does the funding model look like, is there a way to support a differing funding model than a third. We'll continue to do that. I've spoken with the mayor. I know Minister Porter continues to speak with his colleagues across the province because, as you can appreciate, what is an issue for one municipality may not be for another simply by sheer size and how it works and the services that are being provided to their base. And whenever the premiers are speaking, obviously issues that come up around municipalities are on the agenda as well as along with the Prime Minister. One of the things that we in Atlantic Canada continue to tell the federal government that any programs that are geared towards municipalities has to reflect the varying size of municipalities. Everything that can't be made to fit a model of Toronto or Vancouver, and ignoring the fact that we have many smaller municipalities across the province that will require support. So we continue to make sure that the funding envelope is flexible enough that we can deal with some of the challenges facing municipalities. And that's why Minister Porter brought out the $380 million loan that we'll do with municipalities over 3 years. We will look whether or not we can adjust that to amortize it over a longer period of time, which will help support them. But we'll continue to work with them and answer their questions. But I will tell you, there's no question, COVID has been tough on every level of government and businesses across this province and across the country. And it'll take us a while to be able to get back to a level of confidence that municipalities will want to have when it comes to delivering services to their residents.
Next, we'll go to Heidi from CTV. Go ahead, Heidi.
Thank you. This question would be for Dr. Strang. I know we're still in what would, I guess, be called the first wave of COVID-19, but what kind of preparations are being made for a potential second wave of COVID-19 in Nova Scotia?
Well, I think what we're doing, we were making sure that as we move into our recovery, that we all the learnings that we did to respond, whether it's in the healthcare system or across government, working in our communities, make sure we capture those, because that informs us if we get a resurgence at some point, that what we may have to think about again. We're also making sure that moving forward, that we still, while we reopen our healthcare system, we need to maintain some capacity if we get patients with COVID-19, and it's very important that we continue to have public health capacity around the surveillance and the timely follow-up around cases. And as we build in our recovery plans, that also informs us of the steps we need to, if we got a resurgence, of how we may need to reverse those things in a way to deal with any resurgence. So everything we're doing is informs us how we would respond if we get a resurgence at some point in the future, and also making sure we have things in place to have a very strong surveillance system to monitor for COVID and pick up any troubling signs very early on.
Go ahead with your follow-up, Heidi.
I know when this all started, we talked about whether or not there was enough ventilators and PPE for everybody. Would you anticipate having enough for any kind of potential second wave? Like, do we have everything we would need right now, or would we need more?
Well, I think we would go back to where we were at the beginning, and how the NSHA did an excellent job of anticipating what the needs might be, building in how they would increase capacity in a number of ways, and so we'd return to that in terms of to help inform us. We have to understand that we didn't get anywhere close to needing that capacity, fortunately, and that is a testament to the effectiveness of what we did in terms of the COVID response, but also how all Nova Scotians kind of really took to heart the need to adopt all the measures that minimize the spread of COVID-19. So if we get a resurgence, it would be exactly those same kind of things, building on existing plans, things that we worked on back in March, and that would inform how we would respond to any subsequent waves.
Heidi, I think it's also important to recognize that we'll continue to buy PPE, continue to provide stockpile here within the region. And one of the things that across the country is we're starting to see the manufacturing of healthcare equipment to be done in our in our country. We as a province are participating in that, and one of the first things that we talk about in Atlantic Canada, really, when I talk to the premiers, is how do we continue to make sure what the new normal will be when it comes to PPE, not only in the healthcare but in the private sector, and how much of that can we have manufactured here in the Atlantic region, and that will continue to be a focus, not only if there's for a second wave, but quite frankly for quite foreseeable in the future of how we deliver healthcare and ensure that we follow the public health protocols that Dr. Strang has put in place. That'll be there when we start reopening the economy.
Next, we'll go to Keith Doucette from the Canadian Press. Go ahead, Keith.
Premier, speaking of reopening the economy, I think you said last week that Dr. Strang and Minister McNeil would finish up their consultations with business by Friday. I'm wondering how close we are to the release of some kind of plan for the reopening, and whether that'll come either tomorrow or Friday for an opening next week.
So, as I've said many times, Dr. Strang has been working with every association to provide them with the public health protocols. They have been building their own strategy about how those businesses would reopen. So, for example, restaurants would have a different plan than obviously some of the healthcare professions, dentistry, for an example. Those practices are put in place. They will be approved by Dr. Strang, which will be sent out to the associations, who will then communicate that out to their members. That is ongoing, and we'll have more to say about the economy in the not too distant future. I've been very clear. If we continue to see the positive signs in the numbers around COVID here, we'll see activity sometime in early June.
Go ahead, Keith, with your follow-up.
All right. Well, I'm trying to nail you down on when early June is, and it's because people are getting anxious. I'm sure you're aware, and they're looking for this. You've hinted at it for a while. Are you able to give us any more of a definite time when you A, will present a plan, and B, when that plan will be implemented?
First of all, the plan goes out to individual associations. I keep continuing to tell all of you that the plan for cosmetology is different than the plan for restaurants. Each one of them will require different protocols to follow public health. We're being that direct to those associations who represent individuals, and it's up to them then to communicate back to the members. I want to tell you, I hear from many people who are hearing from their associations about what a reopening looks like, how they can do that, and what we want to be in a position, unlike other provinces, instead of saying this company could open today and this one's going to open 3 weeks from now, we want to make sure that our employers in this province have the public health protocols in place, that when we reopen the economy, they will make a business decision. Do they want to open now, or do they want to open at a later date? That'll be something that they will determine, but it will be based on public health protocols. And as I said, we will continue to follow what happened around, and we're seeing very positive signs around the COVID numbers. Those are very encouraging for us, and they have been over the last number of days. We'll continue to watch them, but we will lay out a date when we're confident enough and feel comfortable enough, and we'll communicate that to businesses, giving them time to be able to respond and organizations to be able to respond.
Next, we'll go to Alicia Drouse from Global. Go ahead, Alicia.
Thank you. Just kind of following up on that question, I'm just wondering how public health is actually helping the local independent businesses to reopen that might not be part of a larger association.
So the ones we would be dealing with would be ones that we were actually ordered to close. There are many businesses who chose not to close simply because chose to close, nothing to do with the public health or anything government did, other than their customer base was staying home and not shopping. Many of them are starting to reopen. You'll see though, but they're following the public health protocol: 6 feet of distancing, only so many people in your store, visors in front of the cashiers. You're seeing now ATMs being cleaned between each customer. Those are all following the proper hygiene, self-distancing that public health put out at the very beginning. And it's been encouraging to see those businesses begin to restart across our province, but they're making that based on a business decision for them that their customers are now coming out, and secondly, following the guidelines set out by public health.
Go ahead with your follow-up, Alicia.
I guess I just want to clarify, not every, like some of the businesses that were required to close, like barbershops, tattoo parlors, private gyms, they're not all necessarily associated with an association. So I'm just wondering what's being done to help those businesses come up with a reopening plan.
So I've been working with my colleagues in labor and advanced education, occupational health and safety, and together we're, I'll use the barbers as an example. Not all of them are, but we're actually working with the association, and they've been very cooperative to then reach out to barbershops that may not be part of their association, but they're willing to help communicate out to them. So the same with the fitness industry, that it's quite diverse, but they've been very willing to work and try to, even though it's not a formal association, to work as an informal network to help us out, so to streamline the communication.
Next, we'll go to John McPhee from the Chronicle Herald. Go ahead, John.
Thank you. Mr. Premier, a legislative committee voted this morning to ask the Labour Minister to require all workplaces to make accommodations for workers with children in their plans for reopening. Is this something that you support, and will your government require employers to make allowances such as flexible work hours, that kind of thing?
Well, we've been working to open up childcare centers in the province. We announced that a number of weeks ago. We're continuing to do that. We're on target to hit the number where we thought we would be, which is on June 8th, and we'll continue to provide supports to families across the province as we continue to open up. And you will see workplaces look very differently. You will see employers use different strategies about how they support their workforce. And quite frankly, they may use double shifts. They may use other ways to be able to support them, staggered hours. But many of those private sector businesses will make that decision in conjunction with their employees.
Go ahead, John, with your follow-up.
Thank you. This is for Dr. Strang. I was talking to a woman this morning who has not seen her mom, who is in the nursing home, has not seen her directly since March. She fears that her mom's health is deteriorating because of the lack of contact with the outside world. Are there any plans, given that the weather is getting better, on fair weather days, to allow outside visits with social distancing measures in place?
So we've actually started some conversations with in the Department of Health and Wellness first, as then reaching out with the continuing care sector on this exact issue. How do we, moving forward, what can we do that allows a better, I guess, social interaction for residents and families, but at the same time knowing that we have to maintain a high level of vigilance and safety and protect or minimize any chance for the virus getting into a facility. So we're starting those, actively looking at what those possibilities might be. And you're absolutely right that getting people outdoors and is certainly one way that we could start to do this. But we need to think our way through this carefully, that we balance a number of different risks.
Next, we'll go to Lindsay Armstrong from all Nova Scotia. Go ahead, Lindsay.
Thank you. Premier, going back to support for municipalities, Bill Carson said that the Prime Minister will help fund municipal government shortfalls, but the province is holding things up. We've told my colleague you're having these discussions. Tax time is here. When do you expect support to come?
I'm not sure what he's referring to, the province holding up. We've continued to be on the forefront. Minister Porter has continued to work with his colleagues, both municipalities across the province and his federal colleagues. We continue to work. I continue to work with the premiers across the country and the Prime Minister. I'm not sure what program that he's referring to that we're holding up.
Go ahead with your follow-up, Lindsay.
When support does come, what will that look like? Are you considering grants? Would it be another loan program?
Well, there's different programs that are happening right now. So, for example, there's announcement by the infrastructure minister federally that will change the funding formula, which will help municipalities across the province when it comes to some of the infrastructure stuff that they're doing. So all of those would look very different. It depends on what it is. But the idea that we're somehow slowing down the conversation between municipalities and the federal government, or the federal government has agreed to things that we haven't, I don't know what they are, because it would be news to me if that's the case, because I can tell you we're on an ongoing communications with the national government, and I know Minister Porter is with our partners here in the province.
Next, we'll go to Jennifer Henderson from the Halifax Examiner. Go ahead, Jennifer.
Thank you to all. Dr. Strang, I'm also hearing from people who are wondering if you can give us any sense as to how many weeks it may be before people can see long-term care residents outdoors or inside. Some facilities have even canceled the window visits now that the weather is better. So these people are really locked away, and I appreciate the need to balance the risks, but can you give us any sort of ETA as to when things might loosen up with respect to long-term care homes other than Northwood?
So we've started those conversations. Had a conversation about this this morning, and so it'd be premature to kind of guess at where we're going to land in a time frame. Fully recognizing the importance of the social interaction for residents, connecting with their families, and how that's also important for families. But again, we got to figure out how we do this safely. We're not going to delay on this, but we also need to take the appropriate amount of time to do it well. I'm not going to make a guess at when we might land on a decision. It's premature for that.
Go ahead with your follow-up, Jennifer.
Yeah, so the follow-up does concern the Northwood Centre, Northwood Manor cluster of cases. We're still seeing, as you would well know, one case every day there since Monday of last week, a couple of deaths early last week. Do you have concerns about the fact that we're still seeing new cases daily at Northwood? Any explanation for that?
So I wouldn't say it's daily. We actually went through the weekend. We had about 3 days where we had no cases from Northwood. That doesn't mean to minimize. You're still watching Northwood very carefully. They continue to test residents that are negative. They continue to test them about every 5 to 7 days. And we know that historically, just from Northwood, where that people can be tested negative for a number of times and then test positive. We also continue to test all the healthcare workers on a regular basis. They are actively treating people who are infectious with COVID-19, and even small breakdowns in infection control and their use of personal protective equipment can put people at risk. And that's why we continue to test. So I'm not surprised that we're still seeing some, relatively low numbers, but still seeing some either residents or staff continue to test positive. We still have an outbreak and managing an outbreak at Northwood.
Next, we'll go to Bill Martin from Six Rivers News and Radio. Go ahead, Bill.
Thank you. A question for the Premier. Mr. Premier, at the height of this crisis, you were quite emotional at times about the people who were abusing the protocols put in place to provide safety for all. And as we now approach the end of what Dr. Strang describes as the first wave, how do you feel about the way people are dealing with social distancing and isolation and so on?
Well, first of all, I've been extremely proud of the people of this province who, when they started to following the advice of public health protocol, continued to commit to that. As I said this before, when we saw last week when the family bubble came into place, we saw the photos and online reunification of grandparents with grandkids that they haven't seen for 7-8 weeks. We've seen families coming together. It was a real demonstration to me that people were following the advice of Dr. Strang and public health. And I want to tell all of Nova Scotians it will be absolutely critical that we continue to follow the advice of public health as we start to reopen our economy. It will not be the same experience as it was before COVID-19. It will be critical that we follow the 6 feet separation, that we continue to practice proper hygiene, because one of the things that we've been working really hard at is to try to make sure that we flatten the curve and almost eliminated this virus at this first stage in our province. We've broadened our testing aggressively because what we want to do is, if there is a second wave, that we don't get the spike like we did in the first one, because we've done all the due diligence of following the advice of public health. And so my message to Nova Scotians will be thank you for following the advice and working collectively together. There's no question this virus is deadly. We as a province know that all too well. And we will continue to need your help to keep our citizens safe as we open up the economy and start and get some economic activity happening.
Go ahead with your follow-up, Bill.
Thank you. He's covered it nicely.
Perfect. That's all the time we have for questions.
Thank you, and I do want to start with a thank you to all of you. For the majority of you, continue to follow the public health protocols. I notice on the weekend and on many of my walks, everyone is keeping their distance, and not just from me, but from each other. Family household bubble also seems to be working. The number of cases of COVID is getting very low, and that is thanks to all of you. And thanks to our testing strategy, we are conducting the second highest number of tests on a per capita basis in the country. Our lab technicians have been working around the clock since this began, and I want to thank them and let them know we are not letting up. we will continue to test at a rapid pace as we start to reopen this province. Dr. Strang's consultation with business and associations who were forced to close will continue, and Minister McClellan will continue to do his follow-up. Those of you who have been asked to submit a plan to public health and haven't yet, get on it. Our follow-ups will continue with you, but we require your plan. And today, to help businesses, organizations, and services that public spaces understand how the guidelines will work, we are launching a website, Prepare to Reopen Nova Scotia. This website will help important information. It will answer a number of questions. It will help with the how too. For those that were forced to close, our goal for your reopening is still early June. We will have more to say on that this week. And of course, it all depends on our cases staying low. I know that we are moving more slowly than other provinces, but as Dr. Strang and I have said from the very beginning, this is not a race. Other provinces have opened parts of their economy and had to either close up again or delay the rest of their openings plans because their cases of COVID continue to rise. We may end up with a similar problem, but it won't be because we went too fast too soon. Our opening, though, will have restrictions. We will monitor how it's going with public health as our lens, and we will continue to test strategically. Look for any potential outbreak or hotspots. And I know this has been difficult on business. I know how hard it has been, and some of you are really hurting. But if there is to be a second wave, we want to prevent a major spike. The last thing that I want to do in this province is to have to close down our economy again because we rushed a reopening. We will follow the advice of public health because we want to keep Nova Scotians safe, and we want to make sure that when you make your investment to reopen your business, that we will not have to close you as we go forward. You have been patient, and you're really grasping the importance of following the rules. Remember when we said stay the blazes home? We've come a long way since then. Let's do our best not to go back. Dr. Strang and I are grateful and appreciate your help, but we would not be in this positive position with fewer cases if it had not been for your sacrifice and for all of the hard work for those healthcare workers on our front lines. Today, I want to give a special nod to paramedics during this Paramedic Service Week. Thank you again to everyone. Keep up the good work. Businesses, continue to get ready. The reopening is coming.